Any given time, there are more than 1,000 people here in Connecticut on the waiting list for the gift of life. April is Donate Life Month, and the path before and after getting a life-saving organ is challenging. Joining us now is Hartford HealthCare's Dr. Glenn Morgan, Chief of Transplant Surgery at Hartford Hospital, with more on what's being done to really ease the journey. Dr. Morgan, thanks for being with us. You're also the medical director of St. Vincent's Medical Center Transplant Clinic. Why was that established, and who benefits because of it?
Yeah, no, thanks for having me. Donate Life Month is significant for us in the transplant community. The clinic down at St. Vincent's in Bridgeport is really all about patient experience and access because transplant, like so many other high technology medical fields, is all about understanding where you need to go, who you need to see, and giving our patients access to our our services is critical. Of course, the transplants that we do are done at Hartford Hospital, but we have outreach clinics in Fairfield at Bridgeport, and we're going to be opening one in the southeast corner of the state later this year. It's all about getting to see the patients where they live.
Doctor, how effective are transplant medications in preventing the body from actually rejecting an organ?
These days, they're very effective. We've been able to hone down on the specific mechanisms that cause rejection and really tailor the medications now so that they will just focus on those elements, so that the idea of, historically or the myth about immunosuppression and having to live in a bubble, having to alter your lifestyle and having to alter your the quality of your life is really changed, and people should be returning to normal life if you use common sense, if you follow your transplant center's instructions, take your medicines, go to your clinic visits, take your blood tests, then you will live a normal life. Common sense is a huge part of this.
Okay. Doctor, we've heard in recent years was commonly referred to as a kidney swap. Tell us more about that and how it could impact somebody who's on the waiting list for a kidney.
Yeah, so a kidney swap and exchange is for live donor kidney transplants, and it's really expanded the options for patients who need kidney transplantation, because there will be many people, and we encourage it a lot, to bring a living donor forward as a possible option for them. But often the living donor that person brings forward, even if they're approved, may not be a good match for them, but they might be a good match for somebody else in the country. So let's say somebody brings their brother forward, not a good match, but they might be a great match for somebody in Ohio. And then somebody in Virginia might be a better match for that original recipient. So kidneys are literally flying all across the country as we speak, going from donors into recipients that are better matches. And it's certainly made a huge impact on our patients. And again, it's all about access and giving patients what they need.
Doctor, real quickly in closing, major organs like the kidney or the heart are the most needed, but there are other life-saving donations that a lot of people might not be aware of, correct?
Yeah, absolutely. The solid organs get all the attention, I would say. We do heart transplant, liver transplant, kidney transplant here at Hartford, but there's also pancreas transplants, small intestinal transplants, and then, of course, there's the non-solid organs like bone marrow transplant, cornea, things like that. But everything, gift of life, is covering all of that, solid organs and tissue. And so we're appreciative for the community and all of our patients and their families for everything they do for us.
Doctor, thank you so much for being with us this Friday morning.